Hello friends, my name is Dr. Sharad Gupta and I'm back talking to you about the most common treatment that dentistry has to offer for various dental disease and ailments. So this is a very important and interesting topic, and I am doing it because a lot of my patients requested me, doctor, we would like to know what are options for different dental diseases we have, and I am sure that this video is also going to help you out. So the most common reason our patient visit us or take dental treatment, they seek dental treatment routinely for cavities. Cavity is a decay that affects the enamel, dentine and the inner layer of the tooth. So this cavity causes a lot of problem in the sense that it may act as a food trap area. So as a patient, you are not able to eat properly. You're always having food packing between your teeth, and then you have to remove with the help of a toothpick or by brushing. So it is quite annoying. So the most common treatment for tooth decay is to get cavity treatment done. The treatment that dentistry has to offer is doing your tooth colored cavities by using minimum invasive techniques. So in this procedure, hole is drilled in your tooth to remove all the decay, and then it is filled with the tooth colored material. Whereas at Identity Plus, we also offer drill free treatment by using our very innovative waterless dentistry. So without drilling the tooth, with the help of advanced lasers, we can remove your cavity, and it is also painless and friendly for kids and adults both. Second most common disease our patients suffer is bleeding gums. So we see a lot of patients for bleeding gums, and this is basically some inflammation of your gums due to your medical condition or plaque and tartar. So when you have a bleeding gums, then it can be managed by cleaning of your teeth, and bleeding gum is associated with mobility of the teeth or some gum pocket formation, or the x-ray shows some loss of tooth supporting bone, then you may need to do gum treatment. Again, for the gum treatment, you may either need a flap surgery wherein the gums are opened up and cleaned, the underlying bone and tissue is cleaned of all the bacteria and it is sutured, or else you may go for blade free technique using waterless dentistry. So at Identity Plus, you will realize that we are using quite a modern technique to do a lot of dental procedure on a daily basis. Tooth sensitivity is another issue that bothers a lot of patients. Now, tooth sensitivity may be because of wear of teeth. Some wear of teeth is natural and takes place over a period of time, but if there is a greater amount of tooth wear that is associated by your tooth rubbing nature or habit of grinding of teeth or burring nature, then it may be, your enamel may be getting faster worn out than otherwise, which is age related. So in that case, you may get some sensitivity and your life may be quite disturbed because of tooth sensitivity, not able to eat and drink all type of food. So this may be quite annoying. So tooth sensitivity, when initial stages, can be managed by fluoride application, applying desensitizer, and also by putting protective enamel composites so as to replace the missing enamel, and creating a night wear splint. Night wear splint therapy can further protect your teeth from tooth wear due to grinding. So there are certain dental emergencies like toothache and abscess formation. Now toothache may be because you have a cavity that has gone deep to the pulp of the teeth. When the infection goes deep inside the pulp, then you can't do filling. Then it needs a root canal treatment because we need to remove the infected pulp. And once the root canal treatment is done, the tooth heals, and then you can place a post and core to reinforce the tooth and put a crown over it. Also, if there is a gum abscess formation, then gum abscess can be treated by waterless dentistry or by incision and drainage technique. Many of our patients comes for doctor that we have bad breath. What can be done? I have made a lot of reels on bad breath. But again, I would reiterate, when it comes to dentistry, so if you have spaces between your teeth that act as food trap areas, or if you have a lot of tartar and plaque accumulation, or if you are eating a lot of garlic and onion in the afternoon or during the working hours, then it can cause a lot of bad breath. So it's better to consult your dentist, keep a good oral hygiene practice, and get your dental treatment done as soon as possible so that you don't have any of these issues left. Then there is a toothbrush erosion. I have seen that many of the time patients come to us, so they have their enamel worn out near the neck of the teeth. What do I mean by the neck? I mean that the portion of the tooth surrounding the gums, the margins of the gum, has a ditch, and the patient is getting sensation from there. So that is because of wrong brushing habit. Instead of brushing in a horizontal direction like a rubbing movement, you may use an electric toothbrush which moves in a oscillating direction, and you should use a minimum and very light pressure. Now if you have a missing teeth, missing one or two teeth, or if you have many more teeth missing, then you can think of dental implants, which are like replacing the natural roots of the teeth over which the crowns are screwed. So natural implant is the most sensible and safe and predictable long lasting treatment modality for replacing the missing teeth, whether it is a single tooth missing or full mouth dental implants for replacing full dentures when entire teeth are missing. So it's a very good treatment modality. For the younger patient, they have a lot of malalignment of the teeth, they have crooked teeth, they are not happy with the smile and positioning of the teeth. So orthodontic braces can be considered for that age group. Also now we have most modern Invisalign, which is transparent braces which don't need any metal to be placed, but they are slightly having a sort of limitation in the sense that not all type of difficult cases can be done by Invisalign, whereas conventional braces therapy is much more predictable for all type of cases. Oral cancer, I being a maxillofacial prosthodontist has been doing rehabilitation of oral cancer patients for last 20 years. So patients who have mouth cancer who has been treated by surgeons, they may have a defect in their palate or in the soft palate, hard palate, or any defect in the mandible. So we can help them out by making all type of prostheses, whether it is a mandibular guidance appliance, obturator processes, or any other processes like cleft lip and palate processes, which may not only help them chew and swallow like normal but also appear like normal like before. Besides, various minor surgical procedures can be taken out when you have a wisdom tooth that is bothering your quality of life. Wisdom tooth removal surgery can be done when it is not finding space to erupt. So these are the very most common type of treatment I have discussed with you. So this is a daily dentistry menu for us. And also patients who have some limitations with their smile, they have crooked teeth and discolored teeth, stained teeth, spaces between the teeth, they can be taken up for cosmetic dentistry procedure, wherein we can do some veneer and metal free dentistry, and we can help them a great smile, so they can plan to get a smile makeover. So patients who wish to have a brighter teeth and healthier teeth can also choose to go for teeth whitening. I will also recommend every 6 monthly visit to your dentist for a overall health, and I'm sure that this video will be of some use to you. You have now a better idea what are the various treatment options you have for different dental disease. In case you wish to know more, you can always write to me and the address provided on my email ID. Thank you. Have a great day.